My name is Star Wright, and this is my remediation video for blood therapy. I just want to note that I have no facial piercings and I have my ID badge on. So after this, I'll go ahead and carry on with my video. The first thing that I'm going to do is introduce myself to my patient. I would then move on by identifying my patient using 2 forms of patient identifiers, perform my self-hand hygiene. I would provide my patient privacy by closing the curtain and go ahead further explaining their procedure to them, that I would be there for their blood therapy. I would then go ahead and go over the order, the consent form, the compatibility of the blood. I would go over their ID number, the blood type, RH group, the donor identification number, and I would also review the expiration date. After all that is together, I would set up my tubing. Unfortunately for me, I am remediating this video, so I'll have to use the supplies that I've already used. So I'm just going to start with what I have. So I would perform my self-hand hygiene. Okay, and then from there I would go ahead and don clean gloves. Okay, so as I'm collecting my tubing, I'm going to ensure that it is free from kinks. I'm going to go ahead and ensure that all of my clamps are closed. And after ensuring that all my clamps are closed, I will first be spiking my saline solution. The saline solution that was provided in my pack had a hole in it, so I'm reusing a different saline bag. But I would spike it the same. Like I said, I'm remediating this video, so some of my supplies have already previously been used. I would go ahead and proceed with spiking and hanging the saline bag, which I'm doing now. Okay, I've already checked the bag. Nothing no holes or doesn't look contaminated. I'm going to go ahead and hang my saline bag first. Okay. Alright, and I do not have an IV pole. I'm just doing what I can with my makeshift one for now. Okay, after securing that and hanging that, I'm going to make sure that everything is flowing properly by unclamping all of my hooks, first starting with the upper one, okay, and then the lower, okay, and then I'm going to go ahead and get the drip chamber and expel the air from there, okay. See, the fluid is running, and it is coming out from here. So once I see that that is running, I'm going to go ahead and make sure that I close everything back up. Okay, the next thing that I'm going to do is attach it to the IV catheter. Okay. And then I'm going to go ahead and open again the main flow rate just to see that that is also coming through, and then I will just go ahead and close that back. Okay, leaving that all on the side there. So the next thing that I'm going to do is go ahead and get my blood going. Make sure this stays. Okay. So this is my blood here. I am going to titrate it back and forth to ensure that there's no clotting or cloudiness in the blood a few times. Not shaking or hardly mixing. Okay. And again, like I said, my supplies have been used. So I'm just doing the best of what I have right now. I'm going to go ahead and spike this bag, also my blood bag, and hang it. Okay. And I'm going to be using this hanger over here. So those are hanging. I'm gonna go ahead and open up my clamp here where the blood is. That clamp. Go ahead and open up my other clamp, make sure they're all open. Okay. And then I'm gonna go ahead and expel, I would tap on here and tap this also. It's open. Okay, and we're just waiting for the blood to drip here. Okay. And we're waiting. Here it goes down the tube now. Tapping it. There it goes. It's dripping down quickly now. I just want to wait until it's like really but it's going. Okay. And then it's coming out on this end here. From here. Okay, as the blood carries down the line, it's like a faint pink right now, but it's carrying all the way down, and it's dripping out from here. After I ensure that the blood has made it all the way down through the tube and is running as it should be, I'm just going to go ahead and continue to let the blood drip until the transfusion is completed. And between that time, I'll be staying with the patient for 15 minutes and monitoring them for any adverse side effects, letting them know to call if anything seems to be, if they're not feeling well, if they're feeling any of the adverse side effects. Again, we'll be just monitoring for them for that first 15 minutes, and then from there on until the blood transfusion is complete. After the transfusion, I would go ahead and, of course, provide myself with hand hygiene as I'm walking out of the patient's room, and make sure to dispose of everything in the proper bag that it's supposed to go in. And that completes my remediation.